Good afternoon, class. Today we will discuss how to write a nursing care plan. And my name is Nicole Small, and I will help facilitate today's lesson. Today's lesson objectives include define nursing care plans, understand why nursing care plans are used, identify the key components to writing a nursing care plan, and learn how to develop a nursing care plan. So today's class will be a little bit different. We will utilize the flipped classroom experience. And so how that works is you should have already completed the pre-class assignments and read all the necessary materials for this lesson. We'll also utilize SurveyMonkey. I posted a question in SurveyMonkey and I wanted you to post your comments, and we will take a look at your comments later on in this segment. We will also be utilizing the WebEx Interactive Learning setting, and that's simply where we will meet on WebEx in an interactive learning classroom. And I also assign to you a case scenario, and I'll ask for a student volunteer for that case scenario to present it in the WebEx interactive learning classroom. And at the end of this segment, you will be required to go to a link that I have listed called Quizzes, and I have the code listed as well for you to complete your interactive quiz game. What are nursing care plans? A nursing care plan is like a blueprint for providing patient care or a plan of action for providing patient care. Not only that, but nursing care plans need to be individualized for that patient. So oftentimes one care plan may not work for every patient. You have to look at what that patient has going on, or they may respond differently to those interventions. So you constantly have to reassess a nursing care plan. That's why you want to make it individualized for a patient. Nursing care plans are also based on nursing theory as well. Now let's take a look at care planning versus a care plan. Are those the same? Often these terms have been used interchangeably, but care planning allows the nurse to identify a patient's problems and select interventions that will help solve or minimize problems, while care plans are the written records of the care planning process. Care planning is the action, while the care plan is the record of the action. Now, I posted a question on SurveyMonkey, and the question that I posted was, why do you think nursing care plans are used? Now we will take a look at some of the comments that you guys posted on SurveyMonkey. One student said that nursing care plans keeps everyone on the patient's healthcare team informed. Another student said that nursing care plans are used to determine the needs for the patient. And another student said that nursing care plans help clear up disputes or problems that may arise during care. And you guys are all correct. All of these are important, are reasons why nursing care plans are used. So basically, nursing care plans are used as a learning tool to guide practice. Nursing care plans allows nursing staff to acknowledge the care that they are providing, as well as to share it with other nursing professionals to ensure that continuity, to ensure patient continuity, and to reassess its effects and patient's needs as required. So the important thing that I wanted you to remember about nursing care plans is that they're used to facilitate evidence-based holistic care, and they're also used to record and measure patient care. Now we will look at a video. I posted a video for you guys to watch, and the name of the video is Having a Care Plan. And I wanted you to watch this video to see what was the main point of what you need to do before even beginning to develop a nursing care plan. So I posted the question, on WebEx. And I've asked for you to submit your comments in the WebEx comments box below as to what was the main point of the video. And many of you, your responses were similar. So the purpose of having a plan for developing care plan was to you want to gather all the information, and that is correct. You want to gather as much information as possible on the patient before you begin to develop a care plan. So you want to paint a very descriptive picture of this patient. So what does gathering information look like? You want to review the chart. You want to take a good report on the patient. You want to do a full assessment, and you want to talk with other healthcare team members as well as about what's going on with this patient. So once you gather all the information, you want to reflect on what is important for that patient and write down any major problems. So now that you have gathered all the information on that patient, you want to look at the key components to writing a nursing care plan. And those key components include assessment, nursing diagnosis, planning or goals, interventions, rationales, and evaluation. Now let's take a look at the interactive lesson or exercise that I have posted on WebEx, and I have asked for students to volunteer to go along and fill in the columns on each component of developing a nursing care plan. So the first column is the assessment column. You want to have your subjective data, objective data, and also be very descriptive in this column. And the subjective data will always be what the patient says they are feeling, what they present with. They come in and say, I'm feeling tired or short of breath, or I have pain in my right knee. Your objective data will always be what the nurse assesses, such as vital signs, heart rate, respirations, temperature, things of that nature. And you're also going to include whatever the nurse finds on assessment. So you want to be very descriptive in this column. Next, you will have your nursing diagnosis. And the nursing diagnosis has three components. It must be NANDA approved, it must be related to what the patient has going on, as well as it must be evidence-based by what the characteristics the patient is presenting. And again, that's why you want to be very detailed in your assessment column in order to develop a proper nursing diagnosis. Next, you'll move to your planning and your goals. Once you have your nursing diagnosis, you want to develop goals for your patient. And you want to make sure that these goals are specific and that the goals are always measurable. What is the expected outcome? And you always want to focus the goals on the patient. The patient should always be the center of the goals. Once you have developed your goals, you will develop your interventions. So if you have developed 2 or 3 goals or however many goals, you want to have those same number of interventions to go along with those goals. So what are you going to do for the patient? And how will the patient respond to those interventions? The next column, you will have a rationale. You have a rationale for each intervention. Now, some people choose to use the rationale column and some do not. But I recommend if you're just starting learning to how to learn or to develop a nursing care plan, you need to have a rationale column. And also the rationale column will allow you to incorporate evidence-based practice as to why you're doing the intervention that you're doing. And last, you will have your evaluation column. Was the goal met, or was it partially met or not met? This column will allow you to look at the care plan, and you may have to reassess or revise or continue or discontinue the plan. Now let's put it all together. Here's the case scenario that I assigned to everyone. I'm going to give you a chance for everyone to read over it. So now I will need another student to volunteer to share their screen to show their example of the care plan for the scenario that we just read. So we have for the assessment column, the student wrote subjective data and objective data from the scenario. And the student has the subjective data as what the patient complained of, or what the daughter said what was going on with her father, and that's correct. The objective data, the student has listed the nursing assessment as well as the vital signs, and this is correct. Now we'll move along to the nursing diagnosis column. So the student chose risk for fluid volume deficit related to vomiting as evidenced by patient vomiting 3 times 100 milliliters of greenish fluid and report of poor appetite. So that's a great nursing diagnosis. It has the 3 components. It's NANDA approved. It has the related to and evidenced by. And now we'll move along to the goals. The student wrote 3 goals for this patient. And these goals are patient's urinary output will maintain at least 30 cc's an hour. Patient will be able to tolerate clear fluids without vomiting for 24 hours. And patient's electrolyte levels will remain in normal range throughout the hospital stay. Now we have the interventions. The student has written 3 interventions to go along with the goals. The first intervention will be the nurse will measure patient's urinary output every 2 hours. Second, the nurse will assess the patient's readiness for clear liquids in 4 hours. And third, the nurse will ensure that lab collects blood for electrolyte levels per MD order. Now we move along to the rationale column. The student wrote the 3 rationales to go along with the 3 interventions. So if urine output is less than 30 milliliters an hour, this would be a major concern. And so this may alert the nurse to assess for further problems. So that's why the nurse would want to measure urine output for every 2 hours. The second rationale, you want to replace the fluid that was lost from vomiting. So that's why the nurse will assess the patient's readiness for clear liquids in 4 hours. And third, if the blood work shows a normal electrolyte balance, further steps may be taken. So that's why it's important that the nurse ensure that lab collects blood for electrolyte levels per MD order. And for the evaluation column, the student has said that this patient has met all 3 goals. So this nursing care plan actually worked for this patient. So good job on showing us how to develop a nursing care plan. This concludes today's interactive learning session. So now I want you to go to the link that I've listed below to complete the interactive quiz game. And as I said, I've listed the link below in the code, and you have until August 1st to complete this game. And lastly, if you have any other questions, please refer to the references on this slide, as well as feel free to reach out to me during my office hours or via email, and that is listed on the course syllabus. And again, I have one of the references listed is a simple guide to writing a nursing care plan. And this is a very detailed yet but simple guide, and I really recommend this to help you when developing a nursing care plan. And thank you for attending today's lecture, and I hope it has been very beneficial to you.